Let me continue. I have been educating on Medicare for 17 years, and the libraries invite me to do these Zoom meetings or to come in person and educate because this is a very confusing subject and there definitely is not enough education on it. So I do this presentation called Medicare Made Clear, and it really helps understand the A, B, C, and D of Medicare. So it has the basics of what Medicare is. And then what I like about it is this presentation helps you to understand that once you have Medicare, if you don't have employer coverage, you need to make a choice. And I go into full detail of what the two choices are and explaining exactly what the A is, the B, C is the Advantage plan, and D is the prescription drug plan. So I'm going to get started with the basics of what is Medicare. So Medicare is a federal health insurance program for eligible US citizens. It's funded in part by taxes that you pay while you're working, and it's individual health insurance. What it is not is free. A lot of people seem to think that it's free. It's not a family health plan. So if you age into Medicare, it doesn't mean that your spouse or your dependents will join with you. It's not Social Security and it's not Medicaid. So what is Medicaid? A lot of people have questions on that. So I do like to touch on what's the difference between Medicare and Medicaid. Medicaid is a state government program that helps pay for care costs for individuals, families, and children with limited income. So it's aid if you have low income. The programs vary from state to state, but they do follow federal guidelines, and the eligibility varies from state to state. So Medicaid and Medicare can work together, and that's called dual eligibility. So who could actually get Medicare is a United States citizen, a legal resident, and you have to live in the United States for at least 5 years in a row, including the 5 years just before you apply for Medicare. You must also meet the following requirements. You need to be 65 years or older. You can join if you're younger than 65 with a disability, and any age if you're diagnosed with end-stage renal disease. So you can have both Medicare and Medicaid. I do want to just touch on that again a little bit more because some people are eligible for both Medicare and Medicaid. That is called dual eligibility. I'm not going to go into Medicaid on this presentation, but they just want me to point out that they are two separate things and that you can be dual eligible and get Medicare and Medicaid to work together. You would need to contact Medicare and fill out a Medicare savings program application to see if you qualify for Medicaid. So do I need Medicare if I plan to work past 65? Also, before I go further, I do want you to know that I will take questions throughout the presentation. We'll stop and take some questions. And at the end, of course, if you just write it down, I'll take questions. So let me just move this. Okay, your Medicare enrollment options when you're working past 65 may be different. This comes up often. I'm working, I'm not sure, do I need to join Medicare or not? So you could delay joining Medicare if generally you can delay Medicare past 65 without any penalty if your employer has 20 or more employees and the employer health coverage is considered credible. You do need to enroll at 65 if your employer has fewer than 20 employees, because then your coverage might not be considered credible. If your same applies if you're under your spouse's employer. So you want to make sure that you speak to Human Resource Department and request if you need to enroll in the A and B or not if you have employer coverage. Really, this presentation is for people that do not have employer coverage. They're turning 65 and they need to decide what plan they're going to pick. If you have employer coverage and you have specific questions, of course, we could ask at the end. But this is really, what to do if you don't have employer coverage turning 65. Now, getting Medicare while you're still working. Medicare and your employer insurance can work together. If you take any part of Medicare, you will no longer be able to contribute to your health savings account. That's important. And Medicare will not cover anyone but you. So consider how your dependents will be covered if you do decide to enroll in Medicare. Another thing I wanted to bring to your attention is this is recorded. Also, if you want me to email this presentation to you, please, at the end, I'm going to put up my email information and my phone number so you can contact me. Hit me with an email and I'll send you the presentation. This way you have it and you don't have to try to take notes of all of this. So what does Medicare cover? So Medicare, original Medicare, your red, white, and blue card has two parts. You have Medicare Part A, which will cover your hospitalization, and Medicare Part B, which will be all your physicians. It's your medical insurance. So we'll start with what is Medicare Part A. Again, it's for your hospital stay. It's if you're an inpatient, if you need to pay for your hospital room, your care in special units, if you're in intensive care, this is all going to go under Medicare Part A. Prescription drugs given to you at the hospital, lab tests, x-rays at the hospital, operating room and recovery, skilled nursing, some blood transfusion, hospice, part-time skilled care for at home, and rehab. So Medicare Part A is your hospitalization. So Part A, some facts about Part A, is the premium is free. You're not going to pay for Medicare Part A if you've worked and paid taxes for 10 years or longer. You cannot be denied coverage for Medicare Part A, and the coverage is nationwide, including any qualified hospital in the United States. The coverage and costs are per benefit period, which I'll explain. You must be admitted as an inpatient, and it provides 60 lifetime reserve days. So you have your Medicare Part A for hospital. Again, that's free. And then you have Medicare Part B. So Part B covers all of your doctor visits and outpatient care. So any doctor visit, including when you're in the hospital, an annual wellness visit, clinical lab services like blood and urine tests will all go into Medicare Part B. Your x-rays, MRIs, any scans, some health programs, obesity counseling to stop smoking. You could get all that under Medicare Part B. All of your therapy, your physical therapy, your occupational speech therapy, any diabetes screening, mental health care, your durable medical equipment, wheelchairs, walkers, oxygen will all fall under Medicare Part B, and ambulatory surgery. So some facts about Part B. Part B is not free. There is a monthly premium. And I did get today, I got the costs for 2022. So that did come in. So Medicare Part B in 2021 was $148.50, and it's going to go to $170.10 per month for Medicare Part B. That just got announced today. You cannot be denied coverage to see any doctors when you have original Medicare. The coverage is nationwide. And you will get a premium penalty if you don't join on time. So you want to make sure that you join your A and B when you're eligible. And eligibility, I will discuss in this presentation. So we will be able to review that. So Medicare doesn't cover everything. When you have original Medicare, it doesn't cover everything. For instance, like all of the costs for your care. So you will have, like Medicare covers 80% of your doctors, and you would have a deductible if you went into the hospital. It doesn't cover prescription drugs. You won't get any dental, vision, or hearing care. You can, I shouldn't say any vision. You won't get eyeglasses in original Medicare, but you can see the eye doctor. You won't get hearing aids. So you won't get your eyeglasses, contacts, or hearing aids. Medicare will not cover any long-term care. So if you need help bathing or eating or dressing, you're not going to get that with original Medicare. Excess charges or care received outside of the United States will not be covered by Medicare, Part A or Part B. So now you have original Medicare, you have this A and B card. How do you get more coverage? Because there are expenses affiliated with original Medicare. Once you have the Medicare card, you have two choices. You could keep option one is you keep original Medicare, which allows you to go to any doctor in any hospital. You also, with option one, you pick up a prescription drug plan, a standalone prescription drug plan, and a Medicare supplement plan, also called a Medigap plan. That's option one. If you don't choose option one, then you could go into what they call option two, which is you opt out of original Medicare, out of the A and B card, and you go into what they call Medicare Part C, also called Medicare Advantage Plans, and also called your HMO and your PPO. So this is really the most important part of my presentation, is that once you have original Medicare, what is the difference between option one and option two? The difference between keeping original Medicare and opting out of it and going into what they call a Medicare Advantage plan. So it is that simple. There are two options once you are on original Medicare. Again, this is if you do not have employer coverage. If you have employer coverage, you don't have to decide option one or option two. You would then keep your employer coverage. Most people do, unless they tell me, I have employer coverage, but I have like a $10,000 deductible and it's about, $600 to $1,000 a month. You might then want to opt out of your employer coverage at turning 65 and go on Medicare and option one or option two. So that's a conversation for us privately. If you want me to compare your current employer plan to walking away from it and going on to Medicare. So let me continue with this. So this presentation starts with option two, a Medicare Advantage plan, which means you opted out of keeping the A and B card and you went with what they call Part C. So Part C is another way to get your Medicare benefits. It's an alternative to original Medicare. All the plan members are still in the Medicare group. So a lot of people say, well, great, if I opt out of A and B, then I don't have to pay Part B, that $148.50 this year, going up to $170 next year. You still have to pay that. So whether you choose option one or option two, you still have to pay for Medicare Part B. So the benefits are administered by the plan. The plans are offered by private insurance companies. And most plans, when you go into a Medicare Part C, it builds right into the plan your drug coverage. And the plan, they also call it Advantage plans because they put other things in that you wouldn't get with original Medicare. So sometimes you get a little dental, cleanings put into it, or vision, eyeglasses, a fitness program. So that's what you get in addition to regular Medicare. That's why they call it Advantage. So some other facts about a Part C is you will get the benefits of Part A. So you will get hospitalization built into your Medicare Part C. You will also get the benefits of doctors and prescription drugs. So you have one card, you'll go to the doctor with that card with Medicare Part C, the hospital with the same card, and the pharmacy, all with one card when you have Medicare Part C. The Medicare Advantage plans may also offer additional benefits. Again, you might get dental exams, eye exams, hearing aids, and gym memberships. When you have Medicare Part C, it could be called different things. Could be called Medicare Part C HMO, PPO, or POS, and S&P. The two that are very important and the most popular that I want to explain to you are the first two. An HMO is a health maintenance organization. When you join an HMO, you are signing a 12-month contract that you will go to doctors and hospitals affiliated with the insurance company that you picked. So you cannot go out of their network of doctors. If you do, you pay at your own expense 100%. So at the beginning of the year, we could check and you could say, great, all my doctors participate in this HMO. I checked my hospitals, everything works, sign me up for the HMO. During the course of the year, you cannot opt out of the HMO. So halfway through the year, the doctors and hospitals can. They don't sign a 12-month contract. So if you do go to the doctor and they now have a sign up that says we no longer participate with this HMO, you need to find a new doctor or pay 100% out of pocket. So there's also a PPO, which is a preferred provider organization. So if that scenario happens and now it says we no longer, you go to see your doctor and it says we no longer participate in XYZ plan, you could still go because that's the doctor you prefer to see, but you'll pay a higher copay because they're out of network. But you could still go because that's a preferred doctor. So that's the difference between an HMO and a PPO. Most people prefer the PPO so that they can go to doctors even if the doctors opt out of the network. So a couple of facts about option 2, which is Medicare Part C, is you still must be enrolled in both Medicare Part A and Part B and live in the plan service area. You cannot be denied coverage based on your financial or health status or pre-existing conditions, not a problem. You may be required to use provider pharmacy networks. Coverage and costs vary by plan, and it does change every year. The nice thing about joining option 1 or option 2 is they put an annual limit on your maximum out-of-pocket costs. So this year, for 2022, most of the HMO plans have about a $6,000 to $7,000 maximum out-of-pocket. If you hit that number and you stay in network, then the plan picks up after you've paid out of pocket that $6,000 or $7,000. If you go out of network, it's $11,000. So who's out of network with Medicare Part C? Sloan Kettering only takes Medicare, hospital for special surgeries. So if you have an HMO, you cannot go to those hospitals, but with a PPO, you can go, but you'll pay 30% up to $11,000. So that's how the PPO works. You may be charged a monthly plan premium. Another wonderful thing about the Medicare Advantage plans is a lot of them start with a 0 premium. And the most important is you still must continue to pay your Part B premium to Medicare. So the next part of this is Medicare Part D, and that's your prescription drug plan. And whether you pick your prescription drug plan in option 1 as a standalone prescription drug plan, or it's built right into your option 2, your Advantage plan, It's identical. How it works, how Medicare Part D works is identical. So again, you have two ways of getting it. You can get it in option one as a standalone, or you could get it built right into your Advantage plan. And Medicare Part D plans cover the types of drugs most commonly prescribed for Medicare beneficiaries, specific brand name drugs and generic drugs, and commercially available vaccines not covered by Part B. And when you look at the different prescription drug plans, you're looking at the formulary, which is a list of prescription drugs covered by the plan. So it's tiered. The companies tier the formulary, and the drugs are grouped into tiers based on the cost. And in general, the lower the tier, the lower the cost. And the deductibles may be charged by tier. So for 2022, most of the prescription drug plans have a $480 deductible on name brand drugs tiered 3, 4, and 5, and not on the generic of tier 1 and tier 2. And there are stages with the prescription drug plan. I'm sure you've heard of the donut hole, the coverage gap. So how that works is, I'm going to use an example of $100, the cost of $100 prescription plan. I'm sorry, of a prescription. So you go and pick up your prescription for your heart. It's $100. And the stages of picking up that prescription works like this. At the beginning of the year, you'd have an annual deductible if it's a name brand drug. Again, the deductible this year is $480. Once you've met your deductible, then the drug is discounted and you're in what they call the initial coverage. So every time you go pick up that $100 drug, you pay $5 for it. But the actual cost of the drug is $100. So even though you're only paying $5 out of your pocket, Medicare is counting the full cost of the drug. So every time you pick it up, Medicare goes 100, 200, 300. When you and the drug company have reached the expense of $4,130, even though you've only paid $5, they count the full cost of it. When you've reached that number, then you go into the third stage of the donut hole, the coverage gap. So you'll go pick up that same prescription that you've picked up all year that you've paid $5 for. And now when you go to pick it up, the pharmacy will say, today that's $25 because you're in the donut hole. And now you have to pay 25% of the cost of the drug. When you're in the donut hole, Medicare does not count the full 100, 200, 300 anymore. They're only going to keep tally of what you pay out of your pocket. So when you pick it up, now they're going to go 25, 50, 75, 100, until you alone have out-of-pocket costs of $6,550. When you finally have that expense out of pocket, you then fall into the final stage, which is called catastrophic. And you'll be that till the end of the year, and then you'll pay $3 or up to 5% of the cost of the drug, whatever's, however they figure that out. And then at the end of the year, January, it resets itself again. So that's why people will say, you know what, it started out at $5 and then somehow I'm in the donut hole, I'm paying more. It's really because of the amount that you're paying for your prescriptions, the full cost. So those are the stages of your prescription drug plan, no matter how you get it, whether you're in option 1 or option 2. So some other facts about the prescription drug coverage is you still, you could be enrolled in both Medicare A, Part B, or both. You may be required to use pharmacy networks. And I always suggest once you do enroll in a prescription drug plan, Find out who your preferred pharmacy is. That's the most affordable way to get your prescriptions. The coverage and costs vary by plan and may change each year. And your Part D premium penalty for late enrollment, you could get a penalty if you don't enroll in a prescription drug plan. And I do see this happen. I meet people that say, I'm on no prescriptions. I opted not to enroll in a drug plan. You still need to enroll even if you're not on any prescriptions, because if you decide not to, when you do then want a prescription drug plan, you'll get a penalty of 1% per month that you waited to join. So it's very important that you do join a drug plan. This year, the plans start from $7 and go up to $100 a month in premium. And that depends on the costs, on what prescriptions you're currently on. So now I'm going to discuss a Medicare supplement plan, which is option 1. You keep original Medicare and you pick up what they call Medigap or Medicare supplement plan to go with your original A and B. So this works with A and B. You can't be, it can't be used to pay for Medicare Advantage costs. So you don't have an Advantage and a supplement. You pick one or the other. There's 10 different plans, and the plans are labeled with letters. So it'll be called Plan N, Plan F, Plan G. Plans with the same letter offer exactly the same benefits nationwide. So whoever has Plan F, no matter where you are in the United States, those coverage, the coverage is absolutely identical. Plan F is Plan F anywhere in the United States. The only difference is each company that offers it could put a different price on it. And the plans are offered by private insurance companies. So if you chose option 1, the plan will help pay, and if you choose a supplement plan, it assists and pays for your hospital coinsurance, skilled nursing facility, your coinsurance and co-payments that would be not paid for if you had just original Medicare, costs of your blood transfusion, your hospital stay, hospice, Part B deductible, Part A deductible. A lot of the supplement plans have foreign travel. And what you will not get with the supplement plan is a prescription drug plan. You need to purchase that in addition to a supplement plan. You won't get dental or vision, eyeglasses, or hearing aids. Any custodial care, you're not getting that. Again, I know it repeats it, but a lot of people think that they'll get help with bathing or eating. You won't get that with Medicare or any long-term care. So this is what Medicare supplement plans look like. The supplement plans are lettered A through F, and they're offered by different insurance companies, but all these letters, no matter who you get it from, it's identical. I do want to bring to your attention, it doesn't go in order that A is the least and N is the highest. This year, Plan G is the highest. Plan G is offered for about anywhere from $270 to $350 a month, depending on what company you go with. If you have original Medicare and Medicare Plan G, everything associated with doctors and hospitals would be covered 100%. The only thing that would not be covered is your Part B annual deductible. Medicare Part B's deductible this year was $203, and next year I think they gave me that number too. Let me just look to see if it's on my chart. The Part B deductible, it is. Yep. So this year it was $203. In 2022 it'll be $233. So you'll notice that none of the supplement plans cover Medicare's Part B deductible. So what that means is you have to pay the first $233 to whatever doctor that you see. And then once that deductible is met, if you had Plan G, you have 100% coverage. So if you go to a doctor, a hospital, any surgery, ambulatory surgery, you have absolutely no out-of-pocket expenses at all. Everything is covered 100%. Plan G also has an asterisk next to it because Plan G has this high deductible version. So it's just like car insurance or homeowners insurance. If you put a deductible with it, the premium is lower. So you could get Plan G with a high deductible. It starts at $73 on Long Island per month. You pay the $73. You'd pay all the costs associated with Medicare, the 20%, but your maximum out of pocket in a calendar year would be $2,430. If you ever have in a calendar year that $2,400 out of pocket, then everything is covered 100%. So that would be the lowest plan in premium with supplements is 73, going up to about 300 a month, depending, of course, the lower the premium, or I should say the higher the premium, the more comprehensive the plan. With a Medicare supplement insurance plan, you have to be enrolled in both A and B and live in the state where the plan is offered. There is no medical underwriting in New York, and you'll have nationwide coverage. So you'll have no network of doctors. You can go anywhere in the United States. You could see any doctor, go to any specialist. You're guaranteed renewable as long as you pay your premium. So when you purchase Plan N or Plan G, that plan will remain identical for the rest of your life. Even if they discontinue it, you would never lose it. You'd be grandfathered into it. The plan premiums may vary for the same coverage. So once you look at a supplement plan, you go, all right, I finally decided this is the letter that I want. I'm going with Plan G. You then want to just compare to see what company is offering it at the lowest premium. Plans with more coverage generally have higher premiums, and you must continue to pay your Medicare Part B premium. So I want to show you, this is kind of the basic of how do I choose. So to reiterate, you have original Medicare, which is your Medicare Part A, Part B, your red, white, and blue card. Once you get that and you do not have employer coverage, you need to decide, what plan am I going with? Am I going to go with option 1? Your second step is, do I pick option 1 or option 2? Option 1, excuse me, is keeping original Medicare, picking up a drug plan, and picking up a supplement plan. Option 2 is opting out of original Medicare and picking up a Medicare Advantage plan. So at this point, I gotta put a throat lozenge on. I've been talking all day, excuse me. I'd like to say, before I go any further, do we have any questions? Okay.
You can just type in your question in the chat, or you can also ask. You would have to unmute yourself. Do you have a question?
Otherwise, I'll just keep going. I got my throat lozenger in.
Hello, we have a question.
I have a question. My wife and I have United Healthcare,
Okay.
and you've I don't think you've mentioned that. We just don't know where that fits in. And
Okay.
we used to pay nothing by way of a premium, and then they did this $16 a month. But you know, I'm just wondering
what it is, and
what it is.
that is a question often. A lot of people say, I'm not really even sure what I am in. It wasn't explained to me. You actually chose option 2. So you have what they call an Advantage plan.
Mhm.
And, you know, you have doctors and hospitals in network. And you have what they call Medicare Part C with United Healthcare. United Healthcare also offers option 1 and option 2. They're on both sides, but you're actually currently in in Medicare Part C. I'm not sure if you're in the HMO or the PPO. Yeah, it should say that on your card.
I think you said
It's a
PPO.
PPO.
Yes.
It's a PPO. Yep. So you, with your PPO, you can go to doctors in the network and doctors out of the network.
Mhm.
The plan is as low as $16. And I'm just going to look quick. And then you should know they do have like a maximum out of pocket on your plan with United. I'm going to look. I think it's $7,500 if you stay in network,
Mhm.
and $10,000 if you go out of network. I think those are the numbers. Yes, $10,000 if you go out of network, which would be like Sloan Kettering. Stony Brook Hospital is out of network with, you know, with that PPO.
Okay.
So that's what you're in. You're in option 2. This is the time of year from October 15th to December 7th. If you are in option 2 and you want to go back into original Medicare, you have till December 7th to educate yourself on those options. If you like being in option 2, but you might want to look into different companies, this is the time. You have till December 7th to make change to your plan. On December 8th, whatever you're in, that's it. You're locked into that for the next calendar year. Any other questions?
There's a
Oh,
question
you
in the
muted. Yeah, just, I'm sorry, one to tag on from that. Have we made a stupid choice?
No, I wouldn't say that. No, absolutely not. If you want to go over, like for me to review that with you, contact me after and I'll be
Okay.
more than happy to go into full detail on that plan. I am
Thank
an
you.
agent.
Right.
I'm an agent. So for me to say that I'm a Medicare specialist, I get appointed by every company so
Mhm.
that I know everybody's numbers. So
Yeah,
I
thank
am
you.
an agent for United Healthcare, Humana, you know, Aetna, Blue Cross Blue Shield. I become an agent for all of them, so I know everybody's numbers, and I could help you compare and make sure you're in a good plan. Some
Thank
people,
you. We'll do that.
Thank you ever so much.
no problem.
So there's a question in the chat. Can you explain what lifetime reserves days are? Since we are in New York, could I switch from Advantage to Medigap?
Okay, yes. So you do have the option right now from October 15th to December 7th to switch from an Advantage plan back onto original Medicare, or vice versa, go out of original Medicare and pick a Medigap, I'm sorry, an Advantage plan, so you can. And the lifetime reserves, I'm going to go into that in this presentation. So I'll go into the enrollment periods and how lifetime reserves work also. Okay, I'm going to continue. So Medigap or Medicare Advantage Plan, I'm not going to do that anymore. So I want to go into the initial enrollment period. So you can join Medicare. There's a 7-month window. 3 months before you turn 65, the month you turn 65, and then 3 months after, you will be automatically enrolled in Medicare if you're receiving Social Security. If not, if you're not receiving Social Security and you do not have employer coverage, I suggest 3 months before your birthday, you go on to socialsecurity.gov Medicare and enroll online. It's very simple. If you're not sure, of course, contact me. I will walk you through the steps on how to enroll in both the A and the B. I wanted to just mention one other thing that I forgot to say. So Medicare Part B, this year I said was $148.50 to enroll in Medicare Part B. And next year it's going up to $170.10. But that is based on your income. So if your income is over 88,000, if you file single, or over 176,000 if you file joint, you will pay more, and that's income related for your Medicare Part B and your Medicare Part D. I did forget to mention that. Again, if you want to know exactly where you fall on the chart, contact me privately and I will tell you what your expense, what your cost will be. So, general enrollment period for Medicare Part A and B, if you didn't do it during that 7-month window, is January, February, and March. You can join A and B. It will start in July, even if you join, they allow the open window January, February, and March. So for those who missed their initial enrollment period, you may enroll in both A and B or both. You may choose to enroll in a Medicare Advantage plan, a Medicare Part C, or a prescription drug plan, and late enrollment premium penalties may apply. So a Medicare supplement plan, open enrollment, is the first 6 months of turning 65. But in New York, you could go into a Medicare supplement plan at any time if you have only original Medicare and you never picked anything, option 1 or option 2. At any point, you could join a supplement plan. You could add it to original Medicare, but each company puts a different pre-existing condition wait period on how long before your pre-existing conditions will be covered. As little as 60 days and as far as 6 months before your pre-existing conditions will be covered if you didn't enroll in those 7 months of your birthday. So you may enroll in a Medigap plan later, but you could be denied. That's not in New York. In New York, there's no medical questions and you won't be denied enrollment in a Medicare supplement. There's a special enrollment period if you're working past 65. So it's the last month of your employment. They give you 8 months to join Medicare A and B. But I say never wait the 8 months. As soon as your employment ends, please, within 63 days, I always say the day it ends, the next day have coverage. And of course, I will help you do that. So there's a seamless, no problem, ends one day and you're in Medicare the next day. Call me, I'll walk you through it. But if you want no penalties to apply, do not let more than 63 days go by without enrolling in something when you leave your employer coverage. So for those who delayed enrollment with credible employer health coverage, you'll have 8 months to enroll in the A and B, but you'll only have the first 2 months to enroll in an Advantage plan or a drug plan. And then after those 63 days, you're going to start accumulating penalties. So again, when you walk away from your employer coverage, call me and I'll make sure and I'll assist you to enroll in Medicare while you still have employer coverage. So everything is done. We'll do it 3 months before you walk away from employer coverage, so that the day the employer coverage ends, the next day you're on Medicare. So you will get late enrollment penalties with Medicare Part A if you didn't qualify, if there's none, if you qualify for a free premium, but there's a 10% penalty if you wait to enroll in A. With Medicare Part B, none if you qualify for a special enrollment period, like if you're leaving employer coverage or your spouse's employer coverage, and then you decide to join Medicare Part B, you won't get any penalty. The penalty is for those who, turned 65 and didn't join, and they were like on the marketplace or on an individual plan. And the penalty is 10% every 12 months. And you'll pay that penalty the rest of your life. And with Medicare Part D, you'll pay 1% per month that you wait to join Medicare Part D. And so every year it's a 12% penalty, and that penalty stays with you the rest of your life. So it's really important not to have any gaps in coverage. When can you change a coverage? We right now are in the annual enrollment period. If you are interested in changing your coverage or reviewing your coverage, this is the time. You could do that, of course, with me. You could do it with Medicare directly. I like doing it with, Medicare directly and not with one specific company, because they're not going to tell you all the options that are out there. They're only going to tell you their company's options. So now is the time to join, switch, or drop an Advantage plan or your drug plan, to switch from original Medicare into an Advantage plan, or vice versa, to switch from one Advantage plan to another, or to apply for a Medigap plan. If you join a Medicare Advantage plan, they allow you now to look it over for January, February, and March. If at any point you're not happy with your choice of leaving original Medicare, you now are available to go back into original Medicare. So if you do it in January, then you'll be back in original Medicare in February. If you decide in March, it will start April 1st. And you could switch to a different Medicare Advantage plan or return to original Medicare. You can enroll in a standalone prescription drug plan once you return to original Medicare. Now, your special enrollment period is qualifying life events such as moving, leaving a job, retiring. One thing about COBRA is not considered credible coverage. So I see this mistake often. People leave employer coverage, they take COBRA for 18 months and then contact Medicare and say, all right, now I'd like to enroll. Well, Medicare will count those 18 months on COBRA as a penalty. So when you leave your employer coverage, you want to join Medicare A and B, even if you decide to pick up COBRA. That's very important. So how can I save money? Use preventative services. Medicare, if you're on original Medicare, Medicare now allows preventative services covered at no cost. So that's an annual physical, your blood work done, your cancer screenings done. There's no charge for you on Medicare for that. And there's a whole list on the Medicare website of things you can get done for free. Use your plan's provider network. Ask your doctor about generic options instead of name brand. Use your plan's preferred pharmacy. It's very important. I've seen hundreds of dollars saved by calling up your company to say, and a lot of people don't know to do this. What is my preferred pharmacy? I've been going to XYZ. Meanwhile, if you went across the street, you can get your costs down significantly. And understand your status in the hospital. There is financial assistance, so extra help. You could get extra help, which will assist you with your Medicare Part D costs. Medicare has an extra help application. If you have low income, I definitely suggest looking into filling out that application. There's a lot of resources. Medicaid, Medicare Savings Program, the PACE program. There's also something called EPIC. If you're struggling to pay your prescriptions, New York State has a state pharmaceutical prescription program called EPIC. If you email me, I will send you the EPIC application. It's for people with their income under 100,000. That's the prerequisite to apply for EPIC. So I do suggest, enrolling in EPIC, especially if you're on injectables or inhalers. And where can I go for more help? This is the Medicare Made Clear presentation. Of course, contact me. Sign up, with actually Medicare.gov has a wonderful search tool, and there's a lot of questions answered now on that Medicare website, which is Medicare.gov. And I will list my contact information. Let me pull that up here. I'm sorry about my throat. It's just been one of those long days of talking. But let me do this. Let's see if I could get this up. No, I don't know why not. All right. Well, at this point, I'm going to take more questions if anybody has questions. And I'm trying to pull up my.
So there are a few questions. Oh, go ahead.
No, go ahead, please.
No, I was just about to read a few questions from the chat. You mentioned income. So the question is about what if your income is less than, I guess, the 80 single and one, whatever it was, 100.
Yeah, when you were discussing the Part B and $170 a month, it's going to be for next year. But then you said that it's on like a sliding scale according to your income. So what if your income is below $88,000 a year? Would that be less than then the 170 a year? Is that the minimum?
No, that's the lowest. It doesn't go lower than 170.
Okay.
But if you, let me just get the numbers. If your income is under $1,300 a month, definitely fill out the Medicare Savings Program application, because if you file single and your income is under $1,300, they'll put that back into your Social Security check.
Okay.
Okay.
Yeah,
I have another question. You have accumulated so much valuable knowledge and teaching. How do you get compensated?
So I don't get compensated for this. I volunteer my time and educate. I do these educational programs. And then if I'm your agent, I get paid directly by whatever company you choose, and I don't do these presentations to be your agent. I do them just because there's not enough education out there on just how many people I meet that don't know they opted out of original Medicare and went with Medicare Part C.
Well,
So,
it's a wonderful service, and we thank you very much for.
oh, thank you very much. So yeah, it's definitely needed. There's not enough people educating on the subject.
Okay, there's another question. You can enroll in Social Security, but deferred benefits until you are 70 in order to get maximum social. Oh, I guess it's a comment.
Oh, okay. Don't even get into, so many people ask me, like, when should I enroll in Social Security? I'm not, I'm just here educating on Medicare. That's a whole nother subject that you need to discuss with your accountant.
All right, so another question. What is meant by hospital status?
Your hospital status, so if you have just like original Medicare or an Advantage plan, and they say that you're an outpatient, you could stay in the hospital and be an outpatient for 3 days, and then you're paying on Medicare 20% of that. Where if you're an inpatient, if they put you in as an inpatient, you have one set copayment of $1,400 on Medicare. So you could run into a very expensive bill if they keep you there as an outpatient. So you want to know what your status is and how it's going to affect you with whatever insurance plan you picked. Are you an inpatient or an outpatient? And then you'll know, depending on what plan you're in, option 1 or option 2, then you'll be able to know what your costs are going to be. I've met people before that said, I was 3 days at the hospital. I thought I was an inpatient. I had my own room. And then when I got the bills, I was billed as an outpatient.
Okay.
So that's, I just always say, make sure you know exactly how you're going to be billed. If that makes any sense.
So Advantage plans and supplemental plans, they're completely different. They're just...
Yeah, it's two opposite things. So Advantage plans is you opted out of original Medicare and you went with what they call Medicare Part C. So you're using doctors and hospitals. You went in with privatized insurance with a private company, and you're using doctors and hospitals that are in their network. If you go with a Medicare supplement plan, you're keeping original Medicare. So if you have option 1, you're going to carry 3 cards in your wallet. You're going to have your Medicare card that shows A and B, which will allow you to go to any doctor in any hospital in the United States. You'll have a supplement card that says Plan N, Plan G, and you'll have, that will help you with doctors and hospitals, and you'll have a prescription drug card for the pharmacy. If you go with an Advantage plan, you're in Medicare Part C, you'll have 1 card. Nobody will ask to see your Medicare card. You'll take that 1 card to the doctor, to the hospital, and to the pharmacy. So that's how, a lot of people figure out what they're in. I always ask them, how many cards are in your wallet? Because that's the main difference.
Okay, so there's a question from Chuck, who is turning 65 and is applying for Part A and B. When would I need to apply for the Medigap?
So you want to apply for original Medicare A and B 3 months before your birthday. You'll get your card once you do the application online. You'll get your card in approximately 3 weeks. And then that's when you will figure out what supplement or Advantage plan you want. And you want to do it before your birthday. And usually I'd say try to get that done like 2 months before your birthday. Of course, contact me. I put my information up and I could assist you with that.
All right. Eve says, I'm a consultant, so I don't have a regular monthly salary. My income varies from year to year. How do I figure out my income to apply, for example, for EPIC,
Epic. Okay.
EPIC pharmacy benefits?
Yeah. So how everybody goes by your income from 2 years ago. So to apply and to see what you're going to be paying, if you're going to get income related charges, this year in In 2021, they looked at your 2019 income tax return. So they'll always go back 2 years. Unless you ask for a request, an exception, because you've had a life-changing event, maybe a spouse passed away, or maybe you lost employment, and that's, you could do that directly with Social Security. Otherwise, everybody looks 2 years back. They're going to look this year at 2019. Next year, they're going to look at 2020.
Okay, so there is another question. Great explanation. Thank you. Why would anyone go for Plan B? I meant, why would anyone go for option 2 if you must pay in network? The only positive I see is that you could get glasses and dental coverage.
So people go into Medicare Advantage plans, one, because the convenience of one card for 3 things. 2, because the premiums start at 0. A lot of them start that they're for free. So if you go into option 2, you have a 0 out of pocket, but the expenses occur when you need hospitals, and God forbid you go from a hospital to a skilled nursing facility, you're looking at anywhere from $6,000 to $11,000 out of pocket. In option 1, you're paying a monthly premium. It starts at $74 a month, going up to $300 a month. But if you're in the $74 plan with that G high deductible, your maximum out of pocket is $2,490 this year. So it's how you look at insurance. Some people say, no, I'm not going to end up in the hospital. I just turned 65. I'm healthy. The doctors I want to see are in this network. I want the 0 premium. And they do that for quite a few years. Most people go back to original Medicare and a supplement plan once they're diagnosed with something, and they go, no, now I want it. This is the doctor I want to see, or this is the hospital, or, I want to be able to choose my own, is when they go back into original Medicare. But a lot of people do prefer, the 0 premium. There's a lot to be said about that.
Thank you. You explained that incredibly well. I appreciate it.
No problem. So I thank you all for coming. I think, we kind of wrapped it up. My contact information is up. Please reach out to me. Send me an email, even if you want the presentation, I'll send it to you. And of course, if you have any questions or need any assistance, contact me throughout the year. I'd be happy to help. I always say, put my number in your phone book under Medicare. This way, anything comes up, I could be of assistance.